The empty delta sign is a radiographic finding seen on MRI or CT venography in cerebral venous sinus thrombosis patients. It refers to the appearance of an empty or lucent area within the delta-shaped confluence formed by the superior sagittal sinus, straight sinus, and transverse sinuses. This sign is indicative of a thrombus obstructing venous drainage from the brain. Risk factors include blood clotting disorders, pregnancy, head injury, infections, certain medications, and malignancies. Symptoms typically include severe and persistent headaches, seizures, focal neurological deficits, papilledema, and altered mental status. Treatment primarily involves anticoagulants to prevent further clot formation and promote clot dissolution, with surgical intervention considered in specific cases. Intussusception is the most common cause of intestinal obstruction in children younger than 3. The classic triad in children includes sudden colicky pain, a sausage-shaped abdominal mass on the right that is palpable, and current jelly stool. Patients commonly present with intermittent episodes of pain and vomiting. They may present in the knee-to-chest position during episodes of pain. Patients may be playful and appear well during the asymptomatic periods. However, recurrent brief episodes of pain are characteristic of intussusception. Late stages may present with lethargy. Lethargy and decreased activity may be the only signs of the disease. Adults more commonly present with bowel obstruction such as vomiting, abdominal fullness, and constipation. Late stages present with severe sepsis.
Ludwig's angina is a rapidly progressive bacterial infection of the submandibular, sublingual, and submental spaces beneath the tongue, resulting in severe cellulitis of the neck and floor of the mouth. Early recognition is critical due to the high risk of airway obstruction. Symptoms of Ludwig's angina include tongue elevation, dysphagia, drooling, trismus, jaw locking, and muffled speech. Immediate hospitalization and aggressive antibiotic therapy with airway management are essential to prevent life-threatening complications. The main pathogens are Streptococcus viridans, Staphylococcus aureus, and anaerobes.
Sigmoid volvulus is a condition in which the sigmoid colon twists upon itself, causing obstruction of the bowel. Plain radiographs may show a coffee bean sign. The coffee bean sign appears as 2 rounded, gas-filled structures on plain abdominal X-rays, resembling coffee beans. This is a classic sign of sigmoid volvulus, but may also be seen in other conditions causing colonic obstruction, such as tumors or adhesions. CT can confirm the diagnosis. To relieve the obstruction, endoscopic or surgical detorsion may be necessary.
Amiodarone-induced blue man syndrome, also known as amiodarone-induced skin discoloration, is a rare side effect associated with the use of the medication amiodarone. This discoloration is caused by the deposition of amiodarone and its metabolites in the skin and other tissues, leading to a change in skin pigmentation. The blue man syndrome is characterized by a bluish or grayish discoloration of the skin, particularly in areas with less blood flow, such as the face, lips, and extremities. It's important to note that amiodarone is a very effective medication for certain heart rhythm disorders. Patients taking amiodarone should be monitored regularly for potential side effects, including skin discoloration, and healthcare providers will weigh the benefits of the medication against the potential risks. If a patient develops amiodarone-induced blue man syndrome, the healthcare provider may consider adjusting the dosage, discontinuing the medication, or exploring alternative treatment options.
Acute appendicitis typically present with abdominal pain that migrates to the right lower quadrant, accompanied by symptoms like nausea, vomiting, and fever. Notably, not all patients exhibit classic symptoms, making diagnosis challenging. When managing acute appendicitis, prompt surgical intervention is the gold standard treatment. Laparoscopic appendectomy is preferred over open surgery due to its advantages in reducing wound infections and promoting faster recovery. It is essential to emphasize that even if the appendix appears normal during surgery, It should still be removed to prevent future diagnostic confusion with conditions like Crohn's disease. Imaging modalities such as CT scans and ultrasonography play a vital role in confirming the diagnosis of acute appendicitis, especially in cases with atypical presentations. However, the judicious use of these imaging techniques is crucial to minimize unnecessary radiation exposure and costs.
Omental cake refers to the thickening of the omentum resulting from localized or diffuse infiltration of omental fat by soft tissue density mass. It is a radiological sign which is often identified in CT scan. Omental cake may be secondary to malignant, infectious, or inflammatory etiologies. Notably, the association between omental cake and ovarian cancer has been well established.
A boxer's fracture is a break in the fifth metacarpal bone, near the knuckle. It is the most common type of metacarpal fracture. It is named after boxers because it is a common injury sustained when a boxer punches someone or something with a closed fist. Deformity of the pinky finger, where the knuckle appears bent down towards the palm. This is called volar angulation. In many cases, a boxer's fracture can be treated with splinting, using the ulnar gutter splint, for 6 to 8 weeks. Surgery is typically only required in cases where the fracture is severely angulated, involves multiple fractures, or if there is instability of the joint.
This adult male presents to the emergency department with fever, sore throat, stridor, and drooling. Acute epiglottitis is characterized by a cherry red, swollen epiglottis, which may obstruct the larynx. In children, epiglottitis is primarily caused by infection with the Haemophilus influenza type B bacteria. Treatment typically involves antibiotics and probably prophylactic intubation. Vaccination significantly reduces the incidence of epiglottitis. This 55-year-old female presents with fever, sore throat, and neck stiffness. Retropharyngeal abscess is more commonly seen in patients with penetrating neck injury, foreign body ingestion, and immunocompromised state, such as diabetes, HIV, and malnutrition. Fournier's gangrene is a rapidly progressive necrotizing fasciitis involving the perineum, genitalia, and perianal areas. It is caused by a polymicrobial infection, commonly involving group A Streptococcus, Staphylococcus aureus, and anaerobic bacteria. Patients with Fournier's gangrene typically present with pain, erythema, and swelling of the perineum, genitalia, and perianal areas, accompanied by fever, chills, and malaise. As the infection progresses, necrosis and tissue destruction rapidly spread, leading to bully, skin discoloration, and crepitus. Diagnosis is based on clinical examination, elevated white blood cell count and CRP, and CT scan of the perineum and pelvis. Treatment involves aggressive resuscitation, broad-spectrum antibiotics, surgical debridement of necrotic tissue, and supportive care.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.